When you are first called to a scene, the first thing you need to do is your clinical assessment. Beginning, you start with your scene assessment. Scene all starts for something. S. Safety. It involves a dynamic risk assessment. Have a look around here. Are there any sharp objects around? Is there any moving traffic? Is there a large crowd potentially? Could you also still have an assailant that may be in the area? Next, you move on to C, which is cause. What's happened to the patient? Could this be a mechanism of injury, or could it be the nature of an illness? We normally call them MOIs or NOIs. Make sure to keep an open mind here, as we're currently unaware of what has happened to the patient. Moving on, you go to E, environment. This is where you would bring in the standard infection control procedures. Think about what type of PPE may be required. Do you need your helmet? Do you need gloves? Do you need a hazmat suit? Be aware of the environment around you at this moment in time. Is there water? Could there maybe be some fire? Is the patient on a steep hill? Is the ground loose beneath your feet? Is your patient bleeding? If so, make sure you're aware of any bodily fluids that are lying about. Next, you moved on to N, which is your number of patients. How many patients are there at the scene? Do you need to maybe triage some of your patients? Will you need another ambulance? Have you been called out to a bar fight? Be aware of all the people that could be crowding the patient or patients at this point. Are you going to an RTC, a road traffic collision, or an overdose? Think about the amount of people that could be involved. Finally, you'd move on to your final E, which is extra resources. Do you need any more ambulances, thinking about the patients that you've got? Do you need more gloves? Are the police or fire service required to help you? Is your patient stuck in an awkward position and you might need the SORT team's help to get them out safely? Do you need the helicopter team to come in and assist you? These are all things we have to think about before we even approach the patient. Keep all this in mind and your scene assessment will be done perfectly.